Okay, so today I'm going to talk about the hemoglobin analysis. So this video we will talk about the electrophoresis, and the second video we will talk about the more accurate HPLC. Now we will start with a simple definition and what is the principle behind the electrophoresis. First of all, electrophoresis simply means that the migration of charged particle, okay, under the influence of electric field. That means I'm having a gel, okay, and they will be attached to electric field, okay, like here cathode and anode, okay, and then you will have a charged particle that will travel basically, okay. Under the influence of this electric field, they will basically travel either to the cathode or to the anode, one of them, depend on their nature, their net charge. So this molecule, okay, according to its net charge, it will travel. Now the rate of this migration depend on electric charge, okay, and the size of the molecule and the shape of the molecule. Alright, so the protein electrophoresis, it's of course more complex than DNA electrophoresis. Now why? Now this is important to understand because DNA electrophoresis only depend on the mass, alright? But the protein have different size, different shape, and different charges. That's why it's harder to make this protein. Usually we use this polyacrobial gel electrophoresis. Now under this gel we have two methods for separation, either under the denaturing condition and non-denaturing condition. Now if you choose denaturing condition, this is very good. You will resemble a DNA. Why? Because you are decreasing the parameter you use in order to separate the molecules. Okay, so the more parameter you have, the less accurate and less like more hard to separate. Now let's take an example. So if we are having this denaturing condition, we take the protein and we will treat it with a detergent, okay, SDS, before we go to the electrophoresis. So what will happen when we treat it with SDS, anionic detergenated? What will happen is that my protein will have the same charge as for DNA, but lost their normal shape. So the shape is like they change the shape, but they have the same charge. Alright. But if we are having the non-denaturing condition, we will put the protein under the gel without pre-treatment. So what will happen is that the protein will return their normal charge and their normal shape. So the charge here will be different and the shape will be different. So this will be more difficult to handle. Okay, now so let's talk a little bit about this one. Okay, let's talk a little bit about this one. So first of all, in this slide, it shows you that we will put the gel between two, here, 1 and 2, between two plates. And here we have some buffer, okay? And the sample we use, either pre-treated or non-pre-treated with this SDS, we will put it inside the well, okay? And we will let it migrate, and then according to their charge, size, and shape, and then we will see it. Okay, how we will see it? By using stain. Now, this picture shows you there are different band of protein with different masses, and in order to understand or to know the masses, we have to have the control, okay, to let us know the mass and compare it with the normal. So basically they will be separated according to their mass. So the lighter one will be one point I want to remember in this slide is that you can see this. Here you have a larger mass, here you have small molecules. Of course the small molecules will go faster. Now the reason why the large particle will stay up, they are staying up because they are large, and at the same time the charge will affect it. Okay, so the heavy one will not migrate as such. So in the second figure, all right, we will show you a gel stained. This one will show you a gel that's stained with the bromophil blue. So the each band represents a protein, and to determine the mass of the protein, we run the sample molecule, as you can see here. So it is different to like a reference for us. Now, why we are using electrophoresis for hemoglobin? The reason why we are using it, because first of all, to diagnose, to manage, to monitor, and to let's say screening. So to diagnose a patient who's having blood disorder, like blood sickle cell thalassemia, to monitor the treatment, and to screen for the genetic condition. So let's say you have a couple, they want to find out how likely they are having a child, okay, with this type of disease, so they can use this one, okay, so as inherited disease. Now, there are limitations, and why we are saying that this HbA1c is better than this one, so this is better. Why? Now, this is here we will know why, the reason why. Now, if you are putting these hemoglobins inside the alkaline solution, okay, like let's say separation like with electrolyte at pH. Okay, now we will talk about the pH. So when you are putting alkaline condition, normally the hemoglobin A, hemoglobin O, hemoglobin E will be co-migrate together, and hemoglobin D and G, okay, also co-migrate with S. Okay, so in this condition you cannot, so let's say you have a band, and then you cannot determine which hemoglobin is, right? So they said, okay, you will use acidic to know whether it is S or C, but still the E and O is together, the D and G together, so there is no benefit behind this. So that's why it's better to use HbA1c. Okay, so this is all about electrophoresis. So if you have any question, please feel free to ask.